February is National Children's Dental Month. Here to help parents keep on top of their child's oral health is pediatric dentist and owner of Sweet Tooth Pediatric Dentistry in Middletown, Dr. Erica Patera. It's great to have you with us, Dr. Patera.
Thank you.
I have older kids and I still have to remind them to brush their teeth.
Yeah, it doesn't necessarily get easier with age.
It doesn't. So when does one start the process, really? When should somebody first bring their child to the dentist?
So our recommendation, and the recommendation of the American Academy of Pediatric Dentistry is really to get your kids to the dentist by their first birthday. So, first birthday, or if your kids have a lot of teeth even before then, when there's like 6 to 8 teeth, you can bring them in.
And you say that's really important because you've actually seen some issues by the time they even get to you at 1 or 2 years old.
Yeah, sadly, there's 1-year-olds, 2-year-olds with cavities, and it's everywhere. It's not just, some uneducated parents. We see it all the time, and it's really sad. So, cavities is something that can be prevented. So if we can get those patients and the parents into our office from an early age, we're more likely to prevent that disease.
Right. When kids start getting teeth, I guess, what, 6 months maybe, 4 to 6 months, when they start seeing the teeth popping up,
Yep.
What should parents be doing to help keep those teeth clean?
Yeah, we actually recommend brushing as soon as the teeth come in.
Really?
Yeah.
What do you brush it with?
Yeah, you can use like a little finger toothbrush or just a small infant toothbrush. Even if you're, let's say, breastfeeding throughout the night, you want to wipe down those teeth with a washcloth. It's important. I mean, the teeth, even though they're new, they're still susceptible to decay. So it's just as important to brush them when they're really little.
And you said there are little toothbrushes for that?
Yeah. We actually have little ones that like fit right on your finger, and you can just, it's a little more gentle and easy for the kids.
Wow. Okay, so once they get into that, when they get to that first visit, what do you do for the child?
Yeah, so a lot of parents are intimidated to bring their kid in because they know, especially as a baby, they're going to be crying and upset with us looking at them. But, we don't want that to intimidate parents to come in. We're used to that. If it's a 1-year-old, we know they're not going to be happy to have us all up in their mouth. So,
exactly.
But it's important. It's, the kids don't like getting their diaper changed some days. They don't like putting clothes on. But, just like brushing is something you have to do every day, bringing them to the dentist is really important.
So that first visit, you check the teeth thoroughly?
Yeah. So the vast majority of the appointment is talking, educating the parent what they should be doing. And, the amount of time we're actually working in the kid's mouth in that age 1, age 2 dental visit is really short. We do a great exam, and usually what we do is we sit with the patient lap to lap. So the baby's like in my lap and in the parent's lap. So, it's not as scary. They're not laying down in that big chair. We try to make it fun. We've got lots of toys and video games and
what do you do for the teeth? I mean, do you help protect them too? I think pediatric dentists, they do something special for the young teeth anyway.
Right. So we recommend fluoride varnish every 6 months, and that's it's a really high concentration of fluoride that's really sticky, and it just sticks to the teeth, and that's supposed to be done every 6 months as soon as the teeth are erupted. So it just provides extra minerals for the teeth to become strong for the life of those babies.
And you recommend how many visits a year?
Every 6 months. So, some parents are surprised to hear that, but actually kids change a lot more in 6 months than adults do. They get new teeth, they're going through, maybe a trauma, they fall and hit those teeth, they have a pacifier that they got rid of. There's a lot that happens in 6 months with little ones, and so we see them every 6 months.
And just really quickly, can you just show us, give us a little quick demo as to how they should be brushing their teeth using your friend here?
Yeah, so one thing I always like to say is that brushing doesn't have to happen in the bathroom. So, you can be sitting on a couch and just coming from behind, because that's more naturally usually, because that's how we brush. You just go ahead and brush their teeth, circles and gently.
And that works?
Yeah, it doesn't have to be a full 2 minutes. I brought this timer, but 20 seconds is fine if that's all you can get.
All right, good. And quickly, also the juice.
Yeah.
You shouldn't be really serving orange juice, is that right?
No. So before age 2, we'd say no juice if you can avoid it. Really just water and milk. But and if you are going to give a juice, we recommend not putting it in a sippy cup, just a regular cup, because it can be very damaging to the teeth.
And maybe water it down?
Yeah, I mean, that would be good, but still it's more about the frequency. You don't want them to have even watered down juice more than once a day.
Okay, very good.
Yeah.
Dr. Patera, thanks so much for all those tips.
Yeah, no problem.
I learned a lot.